Optometry certainly has come a long way since my grandfather, Dr. Victor Casella, opened his practice in 1948. It has come even further since my father, Dr. Tom Casella, joined him in 1978. And I am amazed at how much change and augmentation has occurred just since 2008, when I joined my father in the same practice. Our knowledge and understanding of the human eye and visual system has changed a great deal, as has our ability to translate new concepts and science into patient care. As the science of healthcare evolves, our implementation of that science also evolves. But as GOA members know, clinical science is only one aspect of healthcare. The legal aspects of healthcare evolve as well, with changing laws having direct effects on access to doctors and medications. Also, the epidemiology of healthcare is in constant flux, as we are currently in the early stages of a paradigm in which the prevalence of age-related eye disease will increase substantially. In short, change happens, life evolves, and there is not one single optometrist, no matter where or how he or she practices, who is immune or can remain inert in the face of the growing changes in healthcare. Our only logical choice is to embrace change and be as effective as we can to steer that change in the right direction. In the state of Georgia, we have proven time and time again that we can be highly effective in both bringing forward positive change and combating negative change. We have witnessed the changes that have taken us from where we've been to where we are, and we have and will continue to take the steps necessary to ensure that the inevitable changes to healthcare are as advantageous to our patients as they can be. In general, where we have been directly impacts where we are going. It is the culmination of our choice and our circumstance which dictate our future. In a way, determinism and free will both play a role in where we are going. For me personally, I'm a product of loving parents and a loving family. I am lucky every day of my life to be able to be in practice with my father. He has taught me a great deal, not only about running a private practice, but also about life in general. There is no way I could be where I am today without him. In other words, I am very lucky to have had such circumstances early in life. With that said, my choice to marry my bride Laura, and of course her choice to say yes, has been the single best choice I have ever made or will ever make. I am very lucky to have such love and support from Laura and our 2 children, all of whom inspire me to be a better person every day of my life. As an optometrist, I'm very lucky to be practicing in Georgia in the year 2016. That is mainly because of the constant and consistent efforts of those who came before me. Our desirable circumstances in this state are a direct product of decades of hard work to get us to where we are today. I am highly motivated to do all I can to continue our progress in the ongoing quest to give our patients the care they deserve. As the face of optometry in our state, the Georgia Optometric Association is and will continue to be a highly influential force, affecting change in such a way as to help us better care for the patients we serve. We are very fortunate to have such a great team working on our behalf in the form of lobbying for us and our patients at the Capitol. They make sure that our meetings and other events are among some of the best in the country. They handle the day-to-day aspects of organized optometry, all with the goal of representing and promoting the ideals of our profession. Many of us remember the great therapeutic wars of yesteryear, our various changes to scope of practice to give us what we need to care for our patients, upwards of 70% of whom see optometrists for their total eye care. What we cannot allow to fade away, however, are our victories in defending our status quo. Imagine a scenario in which someone looks through a hole in a machine in a mall kiosk and walks away thinking a comprehensive eye exam has occurred. Such dips below the standard of care are not far-fetched, and we have and must continue to all work together to protect and promote the value of what we do and the care of those we serve. I consider it a professional and personal obligation to impress upon our GOA members and prospective members, especially the younger ones, the cold, hard fact that what we do could be taken away from us if our circumstances were different. For this very reason, contributions to GOA and AOA PAC are necessary, expected, and directly beneficial to all of us. We are also very fortunate to have so many optometrists across our state who have answered the call to serve. Whether they are volunteers, serve on our state board, or in our local district societies, participate in eye health screenings, lobby on our behalf on both a state and national level, or do other activities. They work hard to promote optometry as the source for primary eye care. During my tenure as president of the GOA, I plan to facilitate change in our volunteer network to streamline your time as a volunteer to be as effective as possible. I will work hard with our leadership team to ensure that our activities together are more involved and lively than they are ceremonious and solemn. I say this all with our collective goals in mind. The goals which we work toward are both fixed and variable at the same time. We press on with the fixed objective of the advancement of our profession as healthcare in general advances. However, no one knows just exactly what the future will hold. There is no crystal ball for healthcare. All we can do is formulate based upon the information we have at hand. If I haven't called on you yet, I probably will. And I hope you will answer the call to serve to help us all realize our goals. For those of you who tirelessly answer the call time and time again, and you know who you are, thank you. I appreciate all you have done and continue to do. You are an inspiration to us all, and we would never be where we are without you. I will work hard to impress upon our young optometrists the necessity of giving back. And I will also work hard at impressing upon everyone else the notion that it's never too late to get involved and be a part of the solution. And there will always be a need for a solution. There is certainly work to be done, but there is also much reason to celebrate the benefits and satisfaction which comes along with what we do. Preserving and enhancing vision and eye health means tending to what is arguably our most precious sense. As our patient population continues to shift, the importance of who we are and the necessity and demand of what we do will only grow. With eye and visual disorders on the rise, from presbyopia to macular degeneration, we all have a hand in the game. We all have an obligation to fulfill our oath to do what is right for our patients. The next several decades are going to prove to be quite busy for optometry, and we're very fortunate to have such a rewarding profession. It is truly a great time to be an optometrist. Let's all work together to make it even better. Thank you.